The Achievable Foundation had been operating for about 15 years as a nonprofit, as a gap funder for people with intellectual and developmental disabilities. Through our strategic planning work, we realized that the most compelling need that existed out there was access to health care for this population.
Achievable is different from other health centers because it was designed from the beginning to care for people with intellectual and developmental disabilities.
The Achievable Health Center was really needed because access to health care for people with intellectual and developmental disabilities was not at the same level as access to health care for other populations.
When you see someone for the first time, and certainly if you're not thinking about taking care of someone with a disability, it's easy just to say, well, they limp because they have the disability, and to skip over that, even though maybe 2 weeks ago they didn't limp. And if you were curious and engaged and really trying to find the answer to what was happening with the family, you'd find out that that was a change.
I've been at so many different doctors, and they've all treated me like a number. What I like about Achievable, they are people. They treat you like a human, not like a patient.
I have 3 loving kids, 2 of which are special needs. People ask me all the time, say, isn't it difficult to take care of that many kids? Because we're talking 6 years old, 5 years old, and 2 years old. But I tell them all the time, if you have the right team in place, then it becomes a lot easier. And that's what I found at Achievable. I found the right team.
One of the main things that was important to the folks that started Achievable was that we have integrated mental health services.
The primary reason that I have found that either patients or their relatives are concerned when trying to seek out mental health services for an individual that has a developmental disability is the patients are concerned, will the clinician understand my condition and how to appropriately treat not only my mental health condition, but take into consideration my disability as well.
What we're doing here at Achievable is really having a national impact. We're reducing the healthcare disparities of people of all abilities. We're serving as a model nationwide. Truly what we're hoping is that this is a model that will be used throughout the country.
Number 1, we're treated with respect and kindness and not like a number. That's why I love Achievable.
I look forward to coming to the doctor. At my other doctors, when I knew I had an appointment coming up, I would find a reason to cancel.
The doctors at Achievable are advocates for my family.
We often spend time as a board thinking about the future of the Achievable Health Center. We've had a certain level of success, so we think about what's next, what's the next level. Not just for people with intellectual and developmental disabilities, but also for our other underserved patients.
Achievable right now is in a very unique place in that it's really at the cusp of becoming something very large.
There are over 300,000 people with intellectual and developmental disabilities currently being served by the state of California. We want to grow bit by bit and serve as many of these people as we can, along with other vulnerable populations. Provide them with the quality access healthcare, not only that they deserve, but that we know is possible.